Hi everybody, I'm Mary Jane and I'm going to be showing you and demonstrating how to take care of your skin after full face laser. This is our patient Carol. So like I said, I'm going to be demonstrating. You will also be getting the actual sequence of what you'll be doing. This is a little cheat sheet. So Carol is less than 24 hours out from laser and I am exactly 2 weeks today from full face laser. So it's a great treatment. How are you feeling, Carol?
I feel great.
You feel good?
Yeah, I feel really good.
Are you feeling some warmth from your skin, or what are you feeling?
Tightness, a lot of tightness, but that's great. I want it to be
right,
tight.
Right.
Yeah.
And she'll ice today on and off for 20 minutes. You just ice for the first 24 hours. So first thing we're going to do is we're going to go ahead and we're going to wash our hands with antibacterial soap. And then we are providing you with a take-home cleanser, Skin Medica. That's what you'll be using to wash the face. You're going to have a whole sleeve of 4x4s. You're going to have some sticks, and you'll see exactly what we do with the sticks and how to apply the Aquaphor. First thing we're going to do is we're going to get our 4x4s nice and wet. The wetter they are, the easier it is to get off all of this skin that's turning over. So nice, cool, tepid water. You don't need to have any distilled water or anything like that. We're just getting the Aquaphor off. And there is going to be some pinhole bleeding, guys. That's okay. We'll be getting that off. And when you go to, once this is all cleaned up, it'll look nice, but you'll notice that, you know, when you're cleaning the next couple of days, you may have a little bleeding. That's okay. Don't be afraid of it. You want to get all this off.
First, ready.
So after we have all the Aquaphor wiped off, we're going to go ahead and take our Skin Medica cleanser. I have 2 more 4x4s, good and wet, and we're going to make some soap pads. So we'll just squeeze out the Skin Medica cleanser. You don't really need a lot. And we're going to go ahead and make some soap pads, and we're going to go ahead and clean the rest of the skin. And I would set up a little station in your bathroom if you could pull your chair in, and that way you'd have the sink right in front of you and you could put your supplies all lined up and you can actually see yourself washing your face. You're gonna wash your skin first thing when you wake up in the morning, and you're gonna do it before or after lunch, and then you're gonna do it when you go to bed. So we're cleansing 3 times a day. And you can see how nicely it's already cleaning up. You could actually do, I've got like a kind of a light to medium pressure. Can you tolerate this, Carol?
Oh yeah.
Okay, great. So you definitely wanna use these 4x4s. They're nice and smooth, and I kind of turn them around and try and use as much as I can of these. And then we're going to go ahead and get 2 more that are going to have some nice, just plain water to rinse. Okay, so now we're ready to rinse off all the cleanser. So we're going to get 2 more 4x4s. See how many we use, everybody? And we're gonna go ahead and take the cleanser off. And you know, some people wanna swirl like this. Some people can dab. Some can actually swipe. So, you know, it's gonna be sensitive where your areas are a little bit thinner, like under your eyes, or maybe Dr. Charlotte went deeper around your mouth. So, you know, the most important thing is getting all of the Aquaphor off so you can get your skin ready to do the vinegar soaks. And every time you do a washing, you're taking off a little bit more skin. It might feel like you have some coffee grains on your face. Your skin will be nice and tight for the week. You might feel some warmth. These are all normal things. It's super important to take your ibuprofen as directed. And obviously to eat, and really just, I tell people, you know, you're a slave to your face for the first week, but it's worth it, and just Netflix and chill while you're taking care of your skin. No sitting out on patios, no sun. watch out for cats and animals because of cat dander, animal dander. You'll always wash your face when you take care of your skin as well. I think we went over that first thing. Okay, so now we're gonna get ready and do the vinegar soak. Okay, so now we're ready for the vinegar soak, and that's actually step 3. You're gonna soak 4 gauze pads in chilled water solution with 1 teaspoon of vinegar. I already have that made up, everybody. I would make it up the night before in 3 separate bowls. And you're gonna take 4 of your 4x4s and you're gonna cut 1 into a quarter. So that's for the upper lip. And I would put them in the fridge for the night so that the next day when you wake up, they're nice and cold. You don't work out of 1 bowl because it's cross-contamination, so you do need to do 3 separate bowls. It doesn't need to be square or rectangle. It can be whatever, square, rectangle, whatever you want it to be. We're gonna open them all up into rectangles. We're gonna make a mummy mask for Carol. So, see why the towel? Because we have a little bit of dripping. It's nice and cold, right, Carol?
Yes.
This is medicinal, so it could take out some of the heat or the sting, which really shouldn't be too bad. But it says in the directions to leave this on for 10 minutes. You don't need a stopwatch. It's okay if it's 15. It's okay. So we're making a mummy mask. And then this 4th one, we're gonna open into our rectangle, and then we're going to fold it over so it goes right over the nose, and then that cheek, inner cheek area, and then the one we cut into a quarter goes right here. How's that feel, Carol?
Feels good.
Okay.
Mm-hmm.
All right, everybody, we're ready to take off the vinegar soak, and it is just regular white distilled vinegar as part of your supply list, but we'll go ahead and take this off. And this is really, it does feel refreshing. Feels nice, and she's nice and red and bright like a shiny red apple. Now we're ready for applying the Aquaphor, which helps take off the dead skin. And I like to pretend I'm an artist, and I like to squeeze it onto the top of my hand because the heat from my hand will help soften this. And you're gonna take your supply sticks, break them all in half. So now you have 2 supply sticks. You're gonna take the round end and you're gonna go ahead and just mix the Aquaphor. You can start wherever you want applying the Aquaphor. I like to start on the forehead. Some people want to start on the chin. It's okay, wherever you want to start. And we're gonna just get a nice thin layer. This should feel good, right?
It does.
Yeah, and you're gonna wanna get right up under those eyes. That's where we have a lot of wrinkly, crepey skin. And then get under this eye again. You can put the Aquaphor on your lips. A lot of people say their lips are dry. You can kind of see where Dr. Shout started and stopped this laser right along the jawline. Do you have any questions, Carol?
No, I think I'm good.
Just do a thin layer. And that's it. So you're gonna do this for the week. You are gonna come in with a very, very thin layer of Aquaphor on. After the 7 days, you don't wanna come in with a dry face, but you certainly wouldn't need as much as this. And then whatever you don't use, you're just gonna go like this and take off. And that's it. Okay, everyone, so that basically that is the cleansing procedure 3 times a day. You're a slave to your face. Like I said, Netflix and chill. She's gonna come in next week like a bright red, shiny apple, and we'll go ahead and give her our new Skin Medica products that will actually penetrate into her skin for the week, and we'll go from there.